I was very lucky to have been seen by the government of Kenya in 2008 to lead the counseling for the post-election violence in the whole country. And that is where I took very keen interest in counseling after my master's, and it was not easy. I had behind me over 200 counselors, and managing that was not an easy job, but it gave me a lot of experience. And I got to know that counseling can make the country avoid lots of issues which otherwise they would have to deal with as far as health is concerned. So, as a human being, we stand like this, don't we? We start from the head. We don't stand the other way around. You can't stand with the head. You stand with your feet, and the head is above. Mental health is about the head. And that is where the human being starts. And that's why we say mental health is the health, really. Some of the diseases which we struggle with, they're avoidable. They are real avoidable. If you work from here, you can prevent so many diseases. Because when you get traumatized, for instance, you go through a very traumatic experience. There is what develops as PTSD, post-traumatic stress disorder. And that in itself is sickness. You develop psychosomatic symptoms which can manifest themselves in any way, including asthma, including epilepsy, including high blood pressure, and all that. And if we are not careful, we are going to treat the symptoms and not the real issue, which comes from the head, the traumatized head. And in most cases, that's what we do. We have psychosomatic symptoms, and we address the symptoms rather than trying to see what happened. This person is suffering from PTSD. What brought the PTSD, the trauma, multiple trauma? What happened? Is this something that can be reversed? And how do we do it? So how did we come to starting this counseling unit in Makueni? Chair, as you heard, 2014, we had a tragedy here where we lost more than 20 people due to alcohol abuse. And from there, when that happened, the governor came to me and said, what do we do? These people need counseling. And here I must say, I'm very, very happy that there is somebody who understands what counseling means in this county. This is the only country that has a full-fledged counseling unit of 16, the only county that has a full-fledged counseling unit of 16 counselors, 1 unit head and 15 counselors. And as you have heard, they are very well placed, and they also specialize in different disciplines. Because in counseling also, you specialize. And Mariama here is specialized in drug and substance abuse, and is doing a wonderful job. 112 people rehabilitated, some of which come from the county government, the workers from the county government. And he's managed to rehabilitate them. So it just means that we need to reinforce the counseling unit, one. We also need to spread the word to other counties that there is need in every county to have a counseling unit. We have seen it. We have seen it work. We have seen that it can solve very many problems. Before somebody goes to the hospital for bigger symptoms which now manifest themselves as failures, high blood pressure, and so on, they should have been filtered by the counselors. The issue of drug and substance abuse, which has been discussed, it's a real issue. Us being number 2, we are not proud about it. Actually, we are ashamed about it. Because why should we be number 2 in the country? And that's why we are putting a lot of emphasis in drug and substance abuse, reaching out to the grassroots to see how we can prevent our children from getting hooked into this menace. We have a program, thanks to AHF, on the highway of rehabilitating and trying to talk to youths on drug and substance abuse and also on reproductive health. It's a drop in the ocean, but that's where I am concentrating on because I know the highway is a problem for us in Makueni. I would therefore make a request, a very special request, that psychosocial counseling to be seen as a very important contribution to the well-being of people in the counties. And I will make a request that there should be a good working relationship between the people who give medicines and the people who talk. Because sometimes the counselors are referred to as just those who talk. Therefore, they are seen as to be ineffective. But in the real sense, actually, they are the most effective. Because when they manage to talk to people, and the people are convinced that people care for them, then they don't have to take the medication. And that is where we should go, preventive. So counseling is preventive. I really request that as you consider putting mental health at the forefront, there is need for psychiatric wards in the hospitals. There is also need for rehabilitation centers, as it has been said. But there is even more need of life skills training, the support, the psychosocial support, after they have been rehabilitated. What next? Because if they are not engaged very well, they go back to whatever they used to do. So we still have a lot to do, even though Makueni is shining, and Makueni is going to be the model, and we are praying that you see it as a model, but at the same time, you make recommendations for us to even improve because we are not there yet. We have a long way to go. We are not saying we are perfect, but we have tried. At least we have tried. At least we have a counseling unit. We have a psychiatrist. And we have Professor, who is our friend, who comes here, who works with us. So we are doing well.